Hello, I'm Dr. Sameera Kota. I'm a consultant general and laparoscopic surgeon at V9 Hospital, Begumpet. So today's topic is hernias. So first of all, what's a hernia? Hernia is any abnormal protrusion of intestines, omentum, or sometimes rarely solid organs through any defect in the body. So usually these defects, some of them are natural areas of weakness that are there in every human being. Some of these natural weak areas are at the umbilicus, lower part of the abdomen, especially in women who have given birth previously, Paris women we call them, and also in the groin areas, and also in the diaphragm where important structures pass from the chest to the abdomen. Also, there are some natural weak areas through which hernias might occur as age advances or as these defects become bigger and bigger. And some of them are also acquired defects. For example, as age advances and in someone who is not used to exercising their body or building good muscle, in them also some areas slowly become weaker as they get older. And rarely, some defects may be present at birth. These are called congenital defects or congenital hernias. So in these, we have congenital diaphragmatic hernias and congenital umbilical hernias, where at birth only the child will be formed with a defect in the diaphragm or in the umbilical region. So these are all the areas from which a hernia might occur at the later stage of life or at birth itself. What are the symptoms of a hernia? So whenever there is an abnormal protrusion of intestine or omentum from their natural domain into an abnormal area which is outside of their domain, then what happens is the patient usually experiences a dragging kind of pain because of this drag that the intestine or the omentum experiences as it moves into the hernial space. And as this hernia is left like that for a longer time, it will slowly form adhesions or it will get stuck to the surrounding tissues in the hernial sac and it will fail to reduce back into its natural domain. In that case, we call it an obstructed hernia or an irreducible hernia, where sometimes the intestine or the omentum might lose their blood supply and become necrosed, or that part becomes dead, and the patient presents to us in emergency with severe pain, vomiting, abdominal distension and failure to pass stool. So it is important that hernias are diagnosed at an early stage without them getting into a complicated state, and for us to evaluate them appropriately and get operated at as early as possible. So when a patient with hernia comes to us, we examine the patient and we identify whether the hernia is freely reducible or not, and then we ask for an ultrasound to look for the size of the defect and also the nature of the contents inside the hernia. And then we proceed for surgery. There is no medical management for a hernia. There's only surgical management, and that also should be done at the earliest. So nowadays we are doing keyhole surgery or laparoscopic surgery for hernias. So the advantages of doing a keyhole surgery or a laparoscopic surgery for hernia is that we access the abdominal cavity through small holes, and we introduce cameras and laparoscopic instruments into the abdomen and we perform the surgery, and a larger mesh can be placed safely and the risk of infection is much lesser compared to open surgery. The patient will have a cosmetically better scar, smaller scars that slowly become invisible over a period of time. In traditional open surgery, we cut open the abdomen through a large incision and we access the hernia. The risk of mesh infections and surgical site infections are much higher in open surgery than in the laparoscopic surgery, and the patient can also resume back to their daily activities or work very soon after a laparoscopic surgery, while a patient will have to rest for a longer time in an open repair. So these are all the advantages of undergoing a keyhole surgery for hernias. Thank you.